Maybe I can start with one question, and for me it's $1 million question, but we've seen there's so many things we have to think of in urban planning, but what would it be if you have limited resources, like a mayor of a city who has to decide what he or she will address first? What would it be that you choose? I believe, Mark, at some point I saw a presentation of yours where you really measured the different aspects. And in fact, I remember it was physical activity that was the biggest gainer for health. If you introduce more possibilities for people to use their own activity. But maybe I'm wrong. Can you expand a bit about that, or give us some more information? We got a lot of data now with your 3 presentations.
I mean, if you look at it, physical activity is very important for people's health, and most people don't get enough physical activity, and our environments are not made anymore to do a lot of physical activity. You know, too often people just step in the car, drive to work and drive back and sit on the sofa. So how can we build in that? But, you know, having said that, I don't think it's about doing something as such in the city, changing the environment perhaps, but if I would do one thing, is in the city trying to break down the silos and actually get public health people to talk to urban and transport planners, environmental people, get them around the table and come up with a common agenda. Because at the moment that's not happening. And you see the silos, they are all working on their own thing. You know, the transport planner works on the transport, tries to get people as fast from A to B, not thinking about health, blaming the urban planner that he needs to put another road in or whatever. And, you know, there's no common agenda often. And I think that's the first thing. And it doesn't cost that much money. And you can actually make changes very quickly. I mean, I've seen this now in Barcelona, where there has been the will of making changes. And over the last couple of years, they put in about 200 kilometers of cycling lanes. Just by putting a few barriers, plastic things on the road to reduce the space for cars and actually creating space for cyclists. And a lot of people have started to cycle. It's a relatively cheap solution. I mean, there's so much money around, but it's not often done because it was not in the agenda. But now bringing some different people together, they start thinking about these cheap solutions of what you can do. And I think that's the first step.
Fantastic. You would like to say something to that, Jean?
Sure. I think we can't speak in generalities about the world. Barcelona has certain things it can do, but think of Accra, Nairobi, or whatever. And in those places, I would think the first thing you'd want to do is address poverty, address the need for jobs and livelihoods that are safe and conducted in healthy conditions. And so that would be my first thing in those kinds of places where poverty is rampant.
Well, I believe that when you put money or the resources ahead, then it stops you from scoping or daring. I just want to take 2 examples, simple example, perhaps at no cost. There are many mayors who these days do car-free days. They just block one street. It doesn't cost anything, and people go. I think you know that movement. You tell me how much it costs. Okay. The second one, I was in China. I was taken to what they consider as a small village, or if they call it rural area village. For many, it's a big town. It's like 400,000, but it should be village. That's how it's defined. But what they have done there, they start something on what they call acupuncture projects through architectures. And what they have done, they have each village or small community or settlements has a unique project, unique thing that they do alone through their resources. Could just be a tofu factory, could be anything. They are using their resources and then they distribute their capacity. Some could be tasked to sell through Taobao. I don't know, some of you may know Taobao, the system of selling online. So all these things done through that, and it doesn't cost more. And that the quality of life, the well-being of people are now coming back to those counties than leaving the country. I mean, people are coming back to, so there are small things that can happen. So I agree that, yeah, this can all be done, but having this evidence and make that available, I like very much the point of communication that was made this morning. There are many good things happening out there, but sometimes in our own world, we know, but having that type of message that can resonate with all the actors that are in the room will be very relevant. So I would still call for how do we make this message, accessible. People are looking for inspiring examples, and we could.
With citizen involvement again, indeed. No, that's absolutely key to the local ownership. But with that, I would love to open the floor. Yes, please, David.
Yeah, David Yale. And I've got 2 brief comments and then a question. The first from Eugenia's presentation. Oops, I put it on mute. Dave Lahav, Yale. I've got 2 quick comments and then a question. The first from Eugenia's presentation. When some of the earlier conversation, including my own, when talking about public-private, the private was around industry, business, and the point that's brought up was the community, the neighborhood engagement, such as horticulture kinds of clubs, and so to sort of keep that as a balance in our thinking. The second was the concept of bringing in different professions, disciplines together, and it's a Tower of Babel, where everybody's speaking different language. In 2003, Center for Urban Epidemiologic Studies at the New York Academy of Medicine hosted a meeting of architects, urban planners, public health, and clinicians. And everybody was just, clustering within their own groups and, sort of dismissive of the other ones. And I remember a public health person asking an architect, so how do you measure health? And he said, well, that's easy. It's public display of affection. And there were guffaws from all the public health people. And then I thought about it after the meeting and thought, what a neat measure that could be, and how it is that we're learning from each other about different dimensions. So now for the question, and it goes back to the work being done in Antwerp, where you're covering up the highway, and so you have emissions from the cars. You talked about them being filtered, but there's work that's underway, and it's on carbon capture, where you can take carbon dioxide and then sift out simple carbon changes and use that to amplify other services for renewable energy. Is there thought about that?
To be honest, I'm not so familiar with the project. I mean, I've just read about it, I've spoken to some people, and it's more an idea at the moment than anything else. But what the point for me was for this was to say that citizens have a say in this, and they have certain plans, and they would like to take it forward. I mean, I don't know. Do you know any chance more about it?
Yeah, I'm from Belgium, but I don't know
not from
about
Antwerp.
I'm sure they do, David.
But yeah, no, there are many initiatives around this. But I think you see it in different cities. I mean, that's what I said in Barcelona. The same thing is happening at the moment, not documented, but and there are other cities that have done it before. Munich is an example.
Well, Boston has done it with the Central Artery, but there's never any conversation about carbon capture. What the conversation was about how wonderful it had the open space above, and no one's thinking about what's happening underneath, except for the tiles that fell down and killed somebody. But otherwise, that discussion is not happening because who's doing the tunnel? It's the transportation planners, right, who are engineers thinking about how to get it done, but not thinking about this next stage because it's so experimental.
Yes, Joe, please.
I won't forget about Sue either in terms she's online, but I wanted to pick up on something that Jeannie mentioned because one of the one of the issues, you talked about the availability of space, and I think many companies actually have quite large campuses in cities, for example, and this has become an issue for hospitals. Many hospitals in cities have large areas of land that are usually parking lots, but and there may be opportunities for using those spaces. But I wanted to get to that in the context of equity question, because I think we don't necessarily, perhaps each of you comment on that, the degree to which, certainly you mentioned New York, and that's been the new mayor, post-Bloomberg mayor in New York, really made the equity issue of a feature of his work, so the equitable placement of parks or bike lanes or opportunities for use of public space. And I think it's something we don't think about that often, just like each of you to sort of address the equity question as it comes up in the context of planning. Well, difficulties or challenges,
I'll do the New York thing, because in defense of Bloomberg, and his plan was also express the need for public space in proximity to housing, but he never put it in terms of equity. And so I think it's a question of what vocabulary a politician decides to use in terms of what they're thinking about. Again, we're talking about vocabularies and how people present their positions, whether they're professionals or politicians or whatever. I think that we're not having those conversations that bring these themes up.
I think that I think one of the shifts was really outside of Manhattan, because he did do set up the framework for that, but there wasn't much going on in Brooklyn or Queens or the Bronx or the so-called outer boroughs, which is where a lot of the minority and poor populations live. So it was.
Yeah, but we should take this out of New York and take it to the world. And
no, that's why I'm asking the question in terms of the use of planning and space for addressing equity.
Right, and what I'd like to talk to Remy about, and this is slum upgrading, and how people are approaching, in many cities, 40-50% of the cities are informal settlements, and there is no open space, there is no place to congregate, that every inch is taken up by housing, or open sewers, or something like that. So how are you thinking about slum upgrading within these terms of providing spaces?
Sue, do you want to take up that question?
Yeah, sure. I mean, and perhaps to link it back to our earlier question about what would be one of the primary things that you would do. And I completely agree with Jeannie that there's different things in different cities. But we also have to think about what the interventions might be that are not controlled by cities that would transform urban areas, and particularly around questions of equity. And I think so to come to your question, is that perhaps some of the most important levers of change actually lie with national governments and perhaps even with global corporates. And so to be able to be really clear that we understand what the links and the connections are that shape the urban health of cities in general, even when they're not controlled by the local government. So I'm not suggesting for a moment local government is not important or local communities are not important, but not everything that affects urban health and well-being is driven from that scale. And so I think we have to be very mindful of that. And what the climate discussions, I think, have been so successful in doing is that they have begun to look at some of the kind of macro drivers, like energy transformation, and to look at the kind of different scales at which those changes are made. And that has been able to feed not just a climate agenda, but an energy equity agenda. And we have to be able to do the same thing in the context of health. So whether it's about the pricing of medicines or whether it's about land regulation to ensure that there is green space, or if it's about local taxation policy and the devolution of those powers, these are the things which ultimately will fundamentally affect the health of lots of generations. And so being very clear about those linkages is a good place to start if what we are concerned about is health equity in cities.
Can I say something around this as well? Because you mentioned, for example, green space. Green space is also extremely important for health. We've seen it reduces premature mortality, better mental health, better cognitive functioning, and there's a lot of evidence that's good. But what we've seen lately as well in some cities where they start greening certain areas, that we see environmental gentrification. And so the equity issue there, it gets worse rather than better. And I think you need to make sure that if you do some greening, that you take the right policies, put the right policies in place to try to reduce the effect of environmental gentrification. Because I think what we're looking for is equity in cities, and we still got a long way to go, unfortunately, is what we see in all kind of terms. But I believe at the end, cities are common places, where we should have equity.
But that takes some community organization. So you need
Sure.
grassroots organizations that are defending their space and saying, listen to us as well.
Yeah. No, I fully agree.
Absolutely. Katie, I think you were next, and then Rebecca.
Thank you. I think you're starting to get at what my question is. So it seems like that this requires very long-term planning and large investments. And so we know that the public sector can be quite inconsistent with their commitment to certain values and principles. So, one decade you have a fabulous progressive mayor that convinces people that they should have their taxes raised, and these programs should be undertaken that are very long term, and 5 years later you could have something else. So I'm just wondering, as we're starting to think about the public and private sector, could the private sector represent an entity with a more long-term vision and commitment to this change, or is it going to be shorter and even make the commitment more dicey? That's my question.
So you have to go back to the governance issues that we were talking about this morning. It's all about governance, where you give voice to people, different multi-stakeholder partnerships that are representative. It's not just the private sector. It's a private sector with the grassroots. It's the private sector with the academicians. It's the private sector with the professionals. It's got to be, to foment the long-term visions that's needed, is you need a very active civic community that's united and holds politicians' feet to the fire.
Someone else wants to comment on this? Remy? Oh, yes, please go ahead.
Yeah, I think ultimately I agree with Joe that we should be looking at that bigger ticket item of the equity, and I think you presented very well how how inequitable cities are, even when it comes to health in different parts of the world. At UN Habitat, we took a little bit the SDG motto further to now refer to as leaving no one and no space behind, because that really, for us, the way to echo that space where people live, and whoever they are, could be in slum, could be in, but this issue of equity beyond subsidiarity, all the thing is essential. Now on this issue of unpredictability of decisions and policies, I think it's a reality. We know there have been setbacks where you have also progressive, government or policy in place, and sometimes this had been, a challenge. But what Jenny says is very true as well. When you have a big constituency, when you have power behind that, private sector. Just one example, because it's maybe that resonate with many. In Addis Ababa, as you know, they wanted to expand. They had a master plan. They wanted to do this, but the population say no. So that pressure can push back policies or even private sector. I've seen in countries where a private sector had been allocated the land in an area, then the community says no. They had all the documents, they have everything, but they can't. So these elements of partnership and really getting the legitimacy, investing in legitimacy is very important. You can really look at the long term. So for me, I think that will help.
I mean, if I can go on this a little bit, I mean, I think when you look for a long-term vision, I mean, I think it's the private sector is generally very short. If I look, for example, housing development, whatever they do, I mean, it's more about profits next year, what is going to happen. I mean, for politicians, it's not that much better. I mean, it's most of the time a 4-year election cycle. I mean, and then they're out or in, or they can keep continuing. So actually the ones that are more thinking about the long-term vision is the community itself. I mean, that are living there. Most people live for 20, 30 years at the same place. I mean, or many places where I've been in Europe, what I see, it's a long-term, and they have a much larger interest. And I think that are the people that actually have a longer-term vision, what's happening with their community. So I put my money more on the community rather than the private developers who think at a very short term how much money they can make. And coming back to my example for the green space, when you have these drawings about new urban developments, you see always lots of nice green trees, everything looks very green, and actually when it's implemented, you don't see so much green around anymore. I mean, because it's too costly to put in, and people live without green. So
I just wanted to add, I think in very poor places, that people might see their problems as more acute, and it would be hard to see that long-term vision as an investment for something that, I mean, if you live in a slum in Nairobi, I can't put myself in those shoes, but I've been there, and, so all of this might seem a little bit pie in the sky to think about. So maybe there needs to be some short-term things that people can really see the advantage of this type of work.
That's leadership, of course. Let me speak as a former member of the New York City Planning Commission, and let me tell you that communities often exercise what we call NIMBY, not in my backyard. So I think what we need are mediating arenas where the different interests are able to negotiate with each other, because everybody has different motivations. Grassroots have motivations, business have motivations. These are rightful motivations they have given their conditions in life. And so we need to find ways to create mediating atmospheres and structures for bringing decision-making forward, so they're not at a blockade, which we are suffering at the moment in certain places, at any rate. So that's what we need, is that. And that's very ideal, but you can structure in governance procedures ways of moving through decisions, and that's the challenge.
Great. Rebecca? Thank you, and thank you to the speakers. When I lived in Copenhagen and with snow, the first thing that were cleaned were the bike lanes, followed by the sidewalks, and then the roads. So it was very much the prioritization. But my question is a little bit building off of this, is we talked about needing to speak the same language and how to incentivize. But what are some ways to do that, and thinking, are there structural interventions through regulations or policy if something's going to be built people have to come together, or how do you do that? I mean, as you said, people come and go, but the champions are important. But so getting to some of those, what would be some concrete ideas of how to bring people together to think about this? And my second question is a little bit about, all of you presented very strong examples. How are these being shared as best practices or ideas across different communities, regionally, globally, even within different cities in a certain area? Thank you.
Maybe we can start with the first question.
I must say bringing people together is not so easy. I mean, that's, in particular from different backgrounds. Now, I come from the research field, and for us, the projects what we have, I get a lot of funding from the European Union, and part of it is always that you need to bring in other stakeholders and work with others. So over the last so many years, we've been working quite a lot with local planners, with transport planners, with different communities. So that's kind of built in, but it takes so much effort. It's just incredible. I mean, every time, I wish I could stick just to my research and doing it, but it's not so rewarding. You want to see change. I mean, it also, it's nice for me to have another paper, but it's not so good for practice. So what we've been doing recently in our institute, IS Global, is set up a knowledge translation arm. We're mainly research, and takes what we've learned from research and go out to urban planners and others that are interested, and really have an active component interacting with people, I showed you some of the guidelines we did. This was together with different stakeholders, the local and regional government there, where they really wanted to have the urban planners wanted to include some health. So we had many sessions together with them talking about how we would do this. But yeah, it's very slow, and I don't see any other ways because everyone is so busy in a way, and you need to have some money to bring people together, organize some meetings, what get people interested, and how they get away from their daily, priorities to talking to some others. But I don't have the magic pill.
Yeah. Could I perhaps come in on that same question and just to say that I think the issue of incentives is really important. But what we need to be able to do is not only to understand how to incentivize particular actors, so for example, local government, and you can do that by making clear to their political constituency what their deliverables are on urban health questions. And similarly, I think one can do that for other kinds of actors. So I think making visible and kind of putting into the public domain the information about what is their role and responsibility and therefore performance against that is useful. The problem is that, and I go back to the point I made earlier, not everything can be isolated back to a particular actor who can be incentivized or held to account. So I think there is an imperative to create some mechanisms which look across those things. So whether it's at the national scale, and that's through the Treasury or through some national urban policy process, those are really important kinds of places to incentivize. And I mean, to go to, I'm sorry, I didn't get your name, who was speaking earlier, just before me, about the research community. I mean, I do think you can incentivize that the research community look across cases to reflect on macro trends and to begin to bring into purview things which otherwise are missing. And the difficulty has been that the urban health agenda has not been well funded. And where it has been, it's been in very siloed kinds of ways. And it's difficult research to undertake and to bring together in new ways. But I do think that is one of the places where one is actually able to incentivize in interesting and fresh ways that might invigorate.
Thank you. We can take one last question from the audience, maybe? Or, yes, please? You can go to any mic, yeah.
Thank you. It's me again. I don't know if I'm the only politician in the room, but there is something, it happened to me often. Something you didn't mention, and that's a key driver, is the public opinion. And whatever we do, we have to face it. And we see the unintended consequences that sometimes researchers or experts don't tell us. Like if I plant trees, then I've got problem because I've got sparlings. And in some neighborhood, I've got 1,000 sparling in some trees in the neighborhood. The people in the community say, oh, please cut the trees. And if I put water, I've got the mosquitoes, and now they're raising in Europe. I will have dengue in my city if I don't take care of the water. If I put cycle lane, the poor people and the women that don't cycle. If I put green spaces, how do I address gender equity? So that's where the mayors are the good people, if you empower them, that I couldn't say they can mediate. But we have to address the complexity. And when you see the mayor of Paris, she did so much for cycling, but she's having so many newspapers against her. Mm-hmm. And we've been through that in my city also, which is smaller, but we need better communication too, and we need unintended consequences to be addressed, because it's not, you're going to save life by making cycle lane. Like, please define what is a cycle lane. That's a proper cycle lane, what that can change. So that was my point.
I know you've got an extremely difficult job, and I'm glad that I'm not in your shoes. I mean, people are normally fairly conservative. They don't want change. I mean, only after the change has been done, they will say to you, why didn't you do it earlier? Yeah. I mean, I think this is one of these kind of things what's happening. But, I think you put an extremely important point. For us as academics, it's easy to come up with, the cycling lane is good or whatever. Actually, but there's a big step between what you find in academic research and what you actually implement. And that, to a large extent, is missing at the moment. This kind of knowledge translation and implementation. And I think that's what we're really lacking for how do we take a little piece of research and put it into practice. And at the moment, it's just hit and miss a little bit. I mean, and some politicians are quite brave and just go ahead and say, let's do it. Some have success, others not. But we're really missing that little piece of implementation, science, or whatever you can call it.
But one of the reasons why we're missing is it because the researchers don't talk to the people. And who forms the research agenda? We have to talk about that. Who decides what the questions? Who decides what the research questions are that will have practical application?
Sure. I mean, there are many aspects to it.
Great. One last second from each of the panelists, maybe, to round this up. Jeannie?
I think we need to look locally to figure out what the governance structures are that will create the environments in which we can have the conversations that we need across the sectors in order to come together. It's going to take longer, but in the end, the decisions are going to be better.
Remy?
Okay, just one of the takeaways from my side is that I feel that there's a great opportunity now to create that opportunity to be professionally humble, to know that as urban planner, we don't know everything about the city, so that come across that issue of complexity and systems, so that we can be courageous enough to reach out to the water professional, to energy or transport. That is, for me, the first step. Without that, we're going to be very comfortable in our small community. I think that we got everything sorted or worked out. So for me, that's been something that I've been working with, the humility. We don't know it all. We have to reach out.
Wonderful. Sue, would you like to close this panel?
Sure. My point would be that we need to create a new generation, whether they are city activists and civic leaders or politicians or scholars who are passionate about urban health and who are happy to forge really new frontiers and to take us to places and scales of intervention that we haven't imagined before.
Probably we need our new Greta, no, for cities.
Yes.
Fantastic. So maybe we can give our fantastic panel a round of applause.